Welcome to Virginia Medical Updates. My name is Alejandra Gonsalves. Today's topic is sleep. Today we have with us Dr. Hoffman. Thank you for being here with us today, Dr. Hoffman.
Pleasure.
Dr. Hoffman is a pulmonary and sleep medicine specialist with Sleep Centers of Northern Virginia and American Sleep Medicine. Dr. Hoffman is board certified with over 30 years of experience in sleep medicine, critical care medicine, pulmonary disease, and internal medicine. So again, today, Dr. Hoffman, we're going to be discussing sleep. So tell us, what is the importance of good sleep?
Well, defining the importance of good sleep is always a little difficult since we're not really sure why we even sleep to begin with.
Okay.
While there's lots of theories that are around, there's philosophical, physiological, psychological, and theological reasons. The real reason we sleep is yet to be clearly defined.
So it's not just basically getting some rest and resting your body.
No, and in fact, one of the most important things to think about sleep is that sleep is an active process.
Okay.
It is not just the absence of being awake, it is actually a very complicated physiological and psychological process that's necessary for us to get through our daily activities and daily living. The major theories of sleep involve the concept of restoration and consolidation. So the concept being that when you're in certain stages of sleep, your body is going through a healing process, it's going through a restorative process, it's clearing out the difficulties of the day that have accumulated, and in addition, when we're in other stages of sleep, our mind is going through both a restful phase, but also a phase where we're consolidating our thoughts and memories so that it can be used in a functional manner in the future.
Okay.
So the need for sleep is clear in that if you deprive people of sleep, or animals of sleep, or any organism of sleep, certain abnormalities will come into the system that are signs of sleep deprivation.
Okay. So I like that. It's basically an active form of something that you have to do throughout your day, basically. I like the way that you present that, because it is something that's not just, you just go to sleep and you're done for the day. No. Your body's still working for you.
Far from it. When you're sleeping, there's actually different levels and stages of sleep, typically labeled as what's called non-REM or rapid eye movement sleep, which is the non-dream phase of sleep, and rapid eye movement sleep, which is typically thought of as the dream phase of sleep.
Okay.
During non-rapid eye movement sleep or non-REM sleep, these are stages typically 1, 2, and 3. The body is going through different levels of depth of sleep while the mind is at rest. During REM sleep, the mind is extremely active while the body is at rest.
Okay.
And both phases are necessary for productive, high-quality sleep.
Okay, so that's what would basically entail the good sleep that we would need.
Correct.
Okay.
To get good quality sleep, you need not just to have enough hours of sleep, but you also need to go into the deeper, again, more restorative phases of sleep, which are typically the stage 3 non-dream sleep or non-REM sleep, and a certain amount of REM sleep.
Okay, and that's what you said, when your body is at rest.
During non-REM sleep, the mind is at rest.
Okay.
The body is actually fairly active. We go through increased cellular turnover, healing functions increase. During REM sleep, the body becomes essentially immobile, partially so we don't act out our dreams, while our brain is extremely active and is almost as active as it is while awake.
Okay.
And during that phase, we're consolidating thoughts and memories, and again, going through a restorative function on our thought processes.
So a really active, thing to be sleeping, really. You're not just,
Correct.
done out of there. Okay. And so obviously, this is something that, your body has to be functioning well in order to have those processes working well. Are there some disorders that can occur?
The major sleep disorders are broken down into things that occur before sleep, during sleep, and after sleep.
Okay.
The things that occur before sleep are things that people are usually aware of. The most common one is inadequate sleep syndrome, Basically means you're not getting enough sleep because you're too busy with all the things going on in your life, and you've opted to try to cut down your sleep in order to get things done. Usually not a great idea.
So not having your bedtime or going to bed
We
each
know
night.
that not getting enough sleep is associated with increased errors at work, decreased both physical and psychological mistakes.
Okay.
It's associated with poor quality work, lower income. So just
Wow.
not getting enough sleep alone is associated, well, a lot of people are doing it so they think they can get more done, and there's evidence that they get less done and less done efficiently. Even people who say, I only need 4-6 hours of sleep,
Right.
there's evidence that while individually as they may do as well as many people who get more sleep, within themselves they would function at a higher level if they were able to get more sleep. In other words, if they're functional at 4 hours of sleep, they'd be extremely successful if they would get more sleep in.
Okay, gotcha. And so that's actually, you said before going to sleep. What about during
Well, again,
sleep?
the other things about before going to sleep is obviously I just mentioned inadequate sleep syndrome, which is again just a nice way of medicalizing the concept you're not giving yourself enough time to sleep.
Okay.
Insomnia is probably the most common sleep disorder. Insomnia usually regards the inability to initiate or fall asleep.
Right.
There's a secondary form where if you wake up in the evening, difficulty falling back to sleep.
Okay.
Again, with both inadequate sleep syndrome and insomnia, the patients will tell you they're not getting enough sleep for one reason or another.
Okay.
Why someone has insomnia can be very complicated. It's often associated with underlying anxiety features, etc.
But it's something obviously that they're aware of.
They're usually aware of that. When a patient will come to you and say, I'm sleepy all the time, and you say, well, how do you get enough sleep? And they say, no, you're into those categories.
Okay.
Then you have the next phase of disorders where are the diseases that occur during sleep.
Okay.
These are often the most perplexing and also are extremely common. This is where you think you are sleeping. As far as you know, you're getting good quality sleep, but you're tired the next day.
Right.
And by tired, I want to specify sleepy as opposed to fatigued.
Okay.
So you're wanting to actually close your eyes and go to sleep despite what seems to be an adequate night's sleep.
Okay.
These are things such as sleep apnea and limb movement disorder, sleep apnea being the most common, limb movement disorder being fairly common but significantly less than sleep apnea.
Okay.
There's also disorders of sleep that interrupt your sleep where you are aware of interruption, you are waking up, you don't know why you're waking up. Again, sleep apnea, limb movement disorder can cause those types of problems.
Would wake you up out of your sleep.
Right,
Okay.
correct. You'll often wake up not knowing why you woke up because whatever behavior or physiological abnormality woke you up usually is gone by the time you arouse. So you wake up and say, why did I wake up? I don't know. And typically we'll try to go right back to sleep.
Okay. Yes.
Another group of disorders, the parasomnias. These are behavioral disorders in sleep where you're doing things that are either disturbing or worrisome, either to the patient or to the patient's family. And these are typically things such as sleepwalking, sleep talking, sleep eating, and this goes quite a bit. Night terrors, a large number of diseases in children, and there's some diseases in adults such as REM behavioral disorder where you actually don't rest your body during dream sleep and you get up and act out your dreams. And again, these things are usually dangerous in that you can do activities that put yourself in danger and of course disturbing to those people around you.
Okay.
And then the next group of disorders are the disorders where you actually do sleep, you're actually getting good quality sleep. But during the day, there's a signal from the brain to go to sleep at an inappropriate time.
Okay.
And these are things such as narcolepsy, which is probably the best well-known, and idiopathic hypersomnia. And there are several others. These are the most common disorders of each category.
Okay, so the disorder being actually that during the day or at the wrong time, you're feeling the
In
wanting to sleep.
narcolepsy, which is probably, even though there is some disruption of nighttime sleep associated, the primary problem is that during the day, the signal to the brain to go into dream sleep occurs at an inappropriate time.
Okay.
which results in a signal to sleep or become extremely tired. And also because I mentioned earlier, during REM sleep, during dream sleep, normally there's a signal to stop moving your body so
Right.
you don't act out your dreams. This can occur in the middle of the day and you can suddenly lose movement during the day,
Oh, wow.
even though you're otherwise wide awake.
Wow, very interesting. So obviously things that either you're aware of yourself or some of your family members would help you. The snoring, the sleep
Correct.
apnea, like you said, if you're
Snoring
waking up.
and sleep apnea, and I know we're going to talk more about those later, is almost a spectrum of the same problem.
Okay.
And whether snoring is a disease or whether it's a normal function depends on who you speak to.
Right.
But sleep apnea being at the far end. Many of the sleep disorders, the patients do have a low insight into.
Okay.
Patients, for example, with sleep apnea or any of the sleep disturbance disorders will often, when they're asked, are you sleepy, they feel they're not because they've had the disease for so long.
They're so
They
used to
feel
it.
what they're doing is normal, and only after you treat them do they recognize that the world they were seeing was not the world that's really there.
Right.
There are also patients who do sleep through some of their sleep disorders and will not be sleepy, but the consequences of, let's say, sleep apnea, where you're not breathing in your sleep, can start damaging the heart, the lungs, increased risk of stroke, etc.
Okay. So obviously things that maybe through physicals or annual physicals, if you're not aware of it, it's something that should be discussed with your doctor.
It would usually be the type of thing where patients often will not bring these things up to their physicians unless they're asked.
Right.
So, for example, low libido is commonly associated with inadequate sleep, and patients will often fail to mention those things.
Right.
And again, often the patient will be asked, how do you sleep? They say, fine. If you say, are you sleepy during the day? They will then say, yes, I wake up, I'm still tired, I feel like, even though I slept fine,
Right.
I didn't feel like I got any sleep.
Okay. And so tell us a little bit about achieving that good sleep. What would be some tips that you would give in order to make sure that we're getting those, is it the recommended 7 to 8 hours?
Recommended 7 to 8.
Okay.
Most of the world does 7 hours with an hour sleep nap in the afternoon. In the U.S., we frown on that.
No nap, I know,
and
right? It would be great.
Naps are actually physiologically normal, but we tend to force them out of our schedule.
Okay.
Pretty much we see when someone's functioning is being tested for errors and mistakes and functioning levels. Usually around 8 hours, 7 to 8 hours sleep is necessary.
Okay.
9 is helpful for some people, but once you get much beyond that, it usually doesn't help. But it's not just the amount of sleep. You also have to go into the different stages of sleep.
Right. Okay.
So if you are, for example, I'll go back to sleep apnea again. If you have sleep apnea that occurs more in dream sleep than in other phases of sleep, such that you don't enter dream sleep or stay in dream sleep, your sleep will not be restorative. You'll
Right.
wake up with dysfunction similar to not getting enough sleep.
Right. So you can have the time, the hours there, but of course it's not going to do anything for you unless you get that sleep apnea treated.
For healthy sleep, you need to have no disorders that prevent you from going into the deeper stages of sleep. And there's the ones we mentioned are a small number of the numbers that are out there.
Okay.
Again, the quality of sleep can also depend on the timing of sleep. Some people will sleep normally, but in a different time phase from what society demands.
Okay.
Some people will go to sleep very early and want to wake up what would be abnormally early. Other people will want to be a night owl and stay up very late and sleep in very late. And while that might be your own biological clock and circadian rhythm, not a disorder.
Right.
Because your job demands don't allow you to sleep under that schedule, you try to force yourself into what for your body is an abnormal schedule. And again, you end up ultimately sleep deprived as a result.
Okay, so obviously watching our own bodies and making sure that we know exactly what's needed and feeling whether or not we are having that sleepiness and not just the fatigue. So
you have to look out for, again, fatigue. I like to differentiate. When someone says to their doctor, I'm tired,
yes.
comes to my office, says, I'm tired, they can mean different things, and you have to break it down. You have to find out if they're sleepy, which means they want to sit down, close their eyes, and go to sleep. Or fatigue, which means they want to sit down, kind of relax in the chair, but not necessarily go to sleep.
Not exactly tired. Okay.
And tired will be used to describe both by most patients. So
Okay,
you have to
so
break it down because that can guide you to decide a certain number of diseases cause fatigue without causing sleepiness. Those are not the classic sleep disorders.
Okay.
A large number of diseases will cause sleepiness without, and most of those will also cause fatigue.
Okay, so
You've
obviously a
gotta
lot
put
of
them together.
details into it, but I think it's probably best to obviously, like I said, recognize in yourself what it is that is best for you. If you're feeling any type of, something that's wrong throughout your day where you're having that tiredness, but trying to achieve those hours. So
Again, insight into it can be very difficult.
right.
For many of the signs of sleep deprivation, we've talked about being sleepy or quote, tired. But that's not all there is to it. Some patients' sleepiness will manifest or sleep deficit will manifest as changes in personality, moodiness, grumpiness,
Okay.
concentration, difficulty at work, difficulty at school, attention deficit. We hear a lot of it about attention deficit disorder.
Yes.
Anyone who's sleep deprived will have attention deficit disorder, whether they're sleep deprived because of lack of sleep or lack of functional sleep.
Okay, I see. So
And-
obviously it's tied to a lot too, and it's very, very important sleep, obviously, Dr. Hoffman. So thank you so much for these great tips and for letting us know about, how we can try to achieve that good quality sleep. And thank you for joining us here at Virginia Medical Updates. My name is Alejandra Gonsalves, and we'll be happy to see you again with us next time.